The next disease is endocarditis. Endocarditis is inflammation of the endocardium. So the endocardium is a membranous layer that makes up the heart valve. So what can happen is bacteria that get into the blood can make their way to the heart valve, where they can essentially grow on the surface of a heart valve like it's a petri dish. So bacteria will grow on that surface, and what they will do is they will kind of hamper the function of the heart valve, where it won't be able to open and close as it normally would to allow blood to pass through. So kind of the weight of the bacteria would affect that, and then ultimately that could lead to something like an abnormal heartbeat or a heart attack. Another thing that can happen is these large kind of clumps of bacteria growing on the heart valve can break off, and that can cause a blockage within the blood vessel at some other location within the body. So for example, like a pulmonary embolism. So it can be quite a dangerous situation. There are two different forms of endocarditis. There is the acute form and the subacute form. The good thing is the signs and symptoms are the same between the two. It's generally the same process. The only difference between the two is who gets the infection and the causative agent. So like I mentioned, in endocarditis, the signs and symptoms are the same for both forms of the condition. So there will be obviously nonspecific signs and symptoms, things like fever, fatigue, joint pain. That stuff is standard for a lot of different infectious diseases. But more specifically, what these patients would be experiencing are cardiac symptoms. So because of the bacteria growing on the heart valve, it could cause an abnormal heartbeat. It could potentially even cause a heart attack. Some of the bacteria that can cause this infection have hemolytic activity, so it could cause anemia due to destruction of the red blood cells. Infections with these bacteria can also produce lesions on the skin. In endocarditis, you will often see lesions on the hands and feet in the form of ulcers nodes or Janeway lesions. Janeway lesions, which we look at here, are often found on the hands and feet, and they are red spots that are non-painful. If we differentiate these from ulcers nodes are also swollen lesions on the hands and feet, but they, because they're associated with the nerves, are typically going to be quite painful. So with acute endocarditis can happen to anyone. It can happen to anyone that gets bacteria directly injected into their blood. So for example, a contaminated surgical instrument or intravenous drug use. If that would happen, bacteria make their way in via the blood, where they can then travel through the blood to the heart valve, start growing, and cause endocarditis. There are quite a few different bacteria that can cause acute endocarditis, and they are quite dangerous bacteria. Some examples are Staphylococcus aureus, Streptococcus pyogenes, which also can cause strep throat, Streptococcus pneumoniae, which is the frequent causative agent of pneumonia, and then Neisseria gonorrhoeae, which does cause gonorrhea. So these bacteria are known to cause a variety of different infections, but if any of these bacteria make it into the blood, they will travel through the blood to the heart valve, where they would start to grow on the heart valve, ultimately hampering its function so that it cannot open and close properly, which can cause abnormal heartbeat, heart attack. And then again, as the bacteria continue to grow on the heart valve, a mass of bacteria can break off and cause a blockage somewhere else in the body that could potentially be fatal. This condition is one that needs to be treated sooner rather than later. It is typically treated with intravenous antibiotics. So because the infection is in the blood, antibiotics are directly injected into the blood, and then those antibiotics will be able to destroy the bacteria. The sooner that that's done, the better. The longer that you wait, you risk potentially permanent damage to the heart valve or potentially damage to the point where surgery was required. And then you also risk the chance of potentially going into septic shock, where the bacteria release toxins that drop the blood pressure, which could potentially result in coma and death. So it is something that does need to be treated aggressively with antibiotics as soon as possible. So subacute endocarditis is a bit different. The signs and symptoms and the disease progression is the same. What's really different is the causative agent and who actually gets the infection. So in subacute endocarditis, the only individuals that typically get this disease are people with pre-existing heart conditions. So assuming you don't have a pre-existing heart condition, if you got endocarditis, it would likely be acute endocarditis where bacteria were directly injected into the blood. Subacute endocarditis is only really found in people that have a pre-existing heart condition that makes them immunocompromised and more susceptible to the bacteria that causes this disease. The reason why normal, healthy individuals do not typically get subacute endocarditis is because the bacteria that cause it are not really dangerous bacteria. They're actually bacteria that are just frequently found in the mouth. And because most of us have strong immune systems, if those bacteria in the mouth would get into a wound, potentially maybe from brushing your teeth too hard, you make your gums bleed, and the bacteria get into the wound, normal healthy individuals would clear that infection right away and that would be the end of it. But for someone that has a pre-existing heart condition, if bacteria from the oral cavity get into the blood supply through possibly blood vessels in the gums, that bacteria then could go to their heart because they're immunocompromised and then start to grow on the heart valve. And from there, it's the same thing that we already talked about. That would hamper the function of the heart valve, resulting in the signs and symptoms and complications that we discussed earlier. So for these individuals that have a pre-existing heart condition, anytime they are going to get dental procedures done, it is exceptionally important that they be put on antibiotics prior to the procedure. That way, when they go to the dentist and inevitably bleed at their gums, and bacteria get in, they will already have antibiotics coursing through their blood to destroy the bacteria before the bacteria has time to get to the heart valve. So for anyone with pre-existing heart conditions, antibiotics prior to dental procedures and any surgery in general should be put on antibiotics to prevent a case of subacute endocarditis. The next disease is the plague, which in history books you may remember it as the Black Death. So with the plague is caused by a bacteria known as Yersinia pestis. This bacteria can be found within the rodent population, and typically what happens is rodents or pests will carry the bacteria, and then fleas will feed off of the blood of the rodents, so they will become a carrier or a vector for Yersinia pestis. So then when the flea bites a human, it will inject its saliva into the human. The human host will then become infected with Yersinia pestis and will now have the plague. So as far as transmission, humans most commonly get it through the bite of an infected flea. There are various forms of the plague depending on which part of the body is targeted by the bacteria. So there's bubonic plague, which targets the lymphatic system. There's septicemic plague, which targets the cardiovascular system. And then there is pneumonic plague, which is the most dangerous form, and it targets the respiratory system, often leading to fatal pneumonia. So if we look closer at the three different types, so in bubonic plague, the bacteria Yersinia pestis is in the lymphatic system. So you will experience nonspecific signs and symptoms like headache, chills, body aches, but again, those things happen in most infectious diseases. The primary sign that I would want you to remember is the formation of swollen and necrotic lymph nodes called buboes. So when the bacteria gets into the lymphatic system, it does cause the lymph nodes in the neck, underarms, and groin to become enlarged and swollen. And because it does cut off oxygen supply to those areas, they typically will darken and become necrotic. And those dark necrotic lymph nodes are called buboes. So to see what those look like, that's what we'd be looking at here. This is one in the neck, but because we have lymph nodes kind of dispersed throughout our body, we would expect to have them under the arms and in the groin too. With septicemic plague. Septicemic plague is when the infection is in the cardiovascular system. It can either start out in the cardiovascular or it can spread from the lymphatic and then get into the cardiovascular. But nonetheless, you'll experience kind of same non-specific signs and symptoms, fever, headache, chills. But what you're also going to experience are skin lesions known as purpura. So if we look at these skin lesions, this is what purpura would look like, and this is why the plague would get called the Black Death, because the skin would turn dark because of these lesions. What's happening here is the bacteria in the blood is causing the blood vessels to hemorrhage, and blood is leaking out under the skin tissue. So what we're seeing here are essentially blood lesions, and they're known as purpura. So purpura is an indication that the bacteria is in the blood and you have septicemic plague. And then there is pneumonic plague. Pneumonic plague is when the bacteria get into the lungs and cause excessive inflammation. Ultimately, that affects breathing and can often be deadly. With this, it would be a very serious form of pneumonia. So the plague still does happen. I think we kind of think of it more as something from history books, but there still are cases of the plague every year. You're typically going to see it in Africa, Asia, South America, but there are cases of it in the United States. Not a lot, it's relatively rare, but when we do have cases of it, it's most often bubonic plague, and it typically happens out west, so New Mexico, California, Arizona, that's where you'll typically have cases of bubonic plague. Fortunately, it is treatable. So as far as treatment, it does need to be treated with antibiotics sooner rather than later. Once it gets into the blood, it can become exceptionally dangerous there because patients can become septic. But it is something that is very treatable. It's typically treated with a variety of different kind of broad spectrum antibiotics, streptomycin, doxy, Cipro. So it is treatment through the use of antibiotics, obviously sooner rather than later. As far as prevention, there's not a vaccine that you can take. So primary prevention would be avoiding exposure. So because fleas are the primary vector that transmit this disease, you would want to avoid flea bites, and you would want to avoid exposure to rodents which can carry the fleas that could potentially transmit the disease.